We're going to be the best bet. We're going to provide you the best opportunity for the money.
We have a pathway for every citizen of Georgia. It is about the student and always work to try to find a way to say yes to students.
You know, there were days that you would interview that morning and the next day you would have your job as a nurse. So all of our ASN programs, 100% of them met the Georgia board requirement.
And the main thing we hear often is, can you send us some more graduates? Or how long can you work before the next group graduates?
Welcome to Talent Pipeline Georgia, a podcast brought to you by the Technical College System of Georgia. Each month, we bring business leaders, faculty, and students together to explore how TCSG's 22 colleges and 600-plus programs drive workforce development, fuel economic growth, and create pathways to success. Whether you're building a stronger team, shaping policy for the future, or preparing for the next step in your education, TCSG is your partner in progress. Visit us at tcsg.edu for more details. The Technical College System of Georgia. Meaningful careers start here. In this episode, we dive into Georgia's nursing shortage and how the technical college system is stepping up to transform the future of healthcare. We highlight groundbreaking programs, impactful partnerships, and practical solutions that are driving meaningful change across the state. Hear directly from college presidents, healthcare leaders, and TCSG experts as they reveal what's driving change and how these efforts are shaping the next generation of skilled nurses. First up, we'll hear from Director of Curriculum for the Technical College System of Georgia, Tammy Bryant. What strategies is TCSG implementing to expand enrollment capacity in nursing programs, particularly for ASN and CNA students?
Yes, so the Technical College System of Georgia, our mission is workforce, is to get people trained and get them out to the workforce and address those areas of needs. And our faculty work hard in the fact that they have learned to take critical judgment, take that clinical judgment model, which is required for their NCLEX passage, and apply it not only to the didactic within their classroom, but also in the clinical setting. And we know that when you can take what they're seeing in clinical and help them to apply it to the didactic of what they're having to learn out of those textbook and from our computer systems these days, it will make them a better student on that NCLEX. And so we are so pleased with the partnerships that we have across our state with our healthcare facilities, because we could not produce the nurses that we do for the state without the hospital systems that support our programs and allow us to do clinical in them.
How do partnerships with healthcare providers help TCSG nursing programs meet the specific needs of Georgia's healthcare workforce?
So we have some large partners that we work with across our state, especially in our metro area. In the Atlanta areas and the metro areas, we have Wellstar, Northside up there, Piedmont up there. They're some of our huge partners. They have been dynamic in providing clinical faculty for our programs, in the fact that they may, what we call, allow one of their nurses to serve as a faculty instructor 1 day a week or 2 days a week for our programs. In our rural areas, we have some dynamic hospitals here as well. We've got Colquitt Regional in the south. We've got Phoebe Putney. We've got Houston Hospital over on the south over there. Huge hospitals expanding over in our Savannah and Augusta area. All of them, if they cannot help us with clinical faculty, do some type usually of scholarships for our students. They may be a scholarship that they work off after they graduate, which really secures their position at that hospital. A lot of our hospitals are also doing a internship or externship program with our students, so they can get them in there, get more hands-on experience while they're in nursing school, and actually get paid to do an internship or work with that hospital while they're at school, and also build their clinical experience at the same time. So we also have partnerships, with our K-12, as they allow our students to go in there and be school nurses. Our health departments allow them to come in there as well. And then we have some mental health facilities across our state that gives them that experience. So as I said, without our health partners, we could not grow this. We could not grow the
Thank you, Tammy. Building on the theme of partnerships, let's welcome Scott Steiner, President and CEO of Phoebe Health System. Scott, can you share how Phoebe prioritizes investing in the community?
Yeah, it's a role we take seriously and have for decades. That our place here is not just only provide great healthcare for everyone, accessible healthcare, and to show people they don't have to go to the big city to get healthcare. Now there are some things, burns, and some things you're gonna have to go because there's only one burn center in Georgia. But that's our mission, is to do just that, is to show people how they can fit in here at Albany Tech or at Albany State or certainly at Phoebe. And we take that role as the largest employer, biggest economic engine. Because what we know right now, Keith, is we've got 200 nursing openings. I got 200 nursing openings. And what I want to do, right, I want to fill those because I don't want to continue to pay premium dollars to companies that call home outside of Georgia. I want 200 nurses that want to buy a house here. I want 200 nurses that want to join a church, that need to shop at the grocery store, that want to, all of that help builds our community, right? You can imagine if we were looking at an employer that was willing to bring their business to town and they had 200 jobs paying an average of $65,000 a year, we'd be excited, the whole community, right? The mayor, everybody be excited about that. Well, that's what we have today. We employ about 5,500 people already. We need to continue to work on our workforce because it not only helps us, it certainly helps our patients and their outcomes, but it'll help our community. And we know that how important that is, and we're determined to make that happen.
What made the partnership with Albany Tech a perfect fit?
Yeah, I mean, one, they're here, right? I mean, we're located in Southwest Georgia in Albany, and they're here, right? So that made a whole lot of sense. As I mentioned, Dr. Parker was on our board, at the time, and just that conversation, that relationship that we had with Dr. Parker, with Albany Technical College, it just made a whole lot of sense. The United States is 2 million nurses short, so it's just not here in Southwest Georgia. It's all over our nation, and we wanted to be intentional about it. And what we knew is that kids that were interested in technical colleges lived locally, right? They lived in small urban and rural areas versus, if you go to a university setting, Albany State, for instance, is here in Albany and great school, and we have partnerships with them, and they have a large nursing program. The challenge is a lot of those kids are from big cities. They're from Atlanta. They're from Jacksonville, and their intent is to go back, right? To go home, to have their career. And we understand that, but to really seizing upon that opportunity to partner with Albany Technical College, Dr. Anthony Parker was a big piece of that. He was the president of the university, at the time when we were developing this partnership. And he and I, we said, let's go big with this. And it wasn't just how do we create more nurses? It's how do we seismically impact what we're doing. And so we said, how do we more than quintuple the number of students that they have in their nursing program? In order to do that, they needed additional space and investment and living space for these students. And that's what we've created with the Living and Learning Community.
You just mentioned the Living and Learning Community. What kind of feedback are you receiving about it?
Yeah, we're starting to, we opened it, of course, just this past August. For the first time, we completed construction and cut the ribbon. And so we've got our first kind of class in there. But we've had one student who was already in the program, but lived there and finished up and had sent us a note saying, that she was in her 30s and had a family, a young family, and just was so thankful for this opportunity that she couldn't have done it without the support of Albany Tech, without the support of Phoebe. We have employed her, and she feels indebted. And I don't necessarily expect people to feel indebted. What we want them to do is be compassionate caregivers with a big heart, right? And to do a great job for our patients. But we're starting to hear those stories about people that we were there to help with, because again, everybody's got their own challenges, and we're seeing that we've got to shift into our high schools and get our high schools excited about it. We've got to get into middle schools even, and because a lot of times people don't have somebody at home encouraging them, and we need to make sure that we are that encouragement. And so whether you're in your 40s, your 30s, your 20s, if you're in middle school, we're here to encourage you to look at a career in healthcare. And it doesn't have to just be as a nurse. a CT tech, an ultrasound tech, a laboratory, an accountant. We employ a full array of people that work in health. Our IT department, we've got almost 100 people working in IT right here in Albany, Georgia. We could outsource that to Dell or someone else and offshore it. People get awfully proud about offshoring. I'm proud about that we have 100 jobs located here in Albany, Georgia in our IT department. When you call the help desk, you get somebody located right here in our building. That's the right thing to do. That's how we make our connection with the community and how we make our connection with our team members.
Thank you, Scott. Shifting gears, we're now joined by Alvin Harmon, Associate Vice President of Academic Affairs at Central Georgia Technical College. Alvin, why has there been such a surge in enrollment in the nursing program?
The enrollment that we're experiencing in terms of the growth is not only with Central Georgia Technical College, but also the technical college system as a whole. We're experiencing over an 8% enrollment growth throughout the system. Part of that, I will say, as a result of COVID, in that more individuals are looking to move seamlessly into the workforce without getting a 4-year degree first. And what we're noticing is it's not uncommon. Many of our students are continuing their education after they may finish an occupational program or even the general education curriculum. And so what I think we're offering now is a way in which individuals can move into the workforce rapidly, make a livable wage, and then figure out exactly what it is they want to do from a career standpoint long term while being able to take care of themselves and meet just the life needs.
Can you tell me how you guys are meeting the nursing shorting challenge and how pivotal has the state been in that process?
Yeah. So, after COVID, it really exacerbated some of the challenges we have in the healthcare arena. We've been fortunate in that we get great support from our state legislature, from our governor, and that there are different funding mechanisms we can pursue to help us expand our nursing program or as well as our nursing offering. So let's go dig into that just a little bit more. We initially had the Associate of Science nursing degree only on our Warner Robins campus. Well, in the past 4 years, we've now expanded and offer that program on our Milledgeville campus, as well as we also now have a bridge program where students who have an LPN or a paramedic degree can bridge from that to an ASN program. And so as a result of the funding we've received from the state, the federal awards that we've been fortunate enough to receive, we've been able to renovate those labs and high quality SIM mannequins so we can enhance that training experience for students. That funding has allowed us to hire more nurse educators, which is a critical component that is really influencing how much we can actually grow our nursing program. So I'm happy to say that now we have not only 2 cohorts of 40 students on our Warner Robins campus for the ASN program, but we now have 2 cohorts of 40 students on the Milledgeville campus. And this fall, we'll be accepting 40 students into our LPN paramedic bridge program. And so that is how we are really trying to help this critical nursing staff shortage that exists. And then at the same time, providing an affordable cost, providing quality instruction. Students can finish this program in 4 semesters and we go year round. And so that really helps us not only serve the community, but help our partners meet the needs that they have as they have more retirees. Individuals may be moving. And so we can have employees that choose not to move to the travel nurse side, and there's nothing wrong with that. But we want employees to stay with that location, such as Houston Healthcare or Piedmont or Atrium for the long term.
How pivotal has the vision from the school president been in the success of the program?
Okay, so one of the things he asked us to do is always remember that it is about the student and always work to try to find a way to say yes to students. That does not mean we're going to ignore a policy or a practice or guidelines, but how can we get to yes for our students? And that attitude and mindset, you see it permeate not only through leadership, but also through our faculty and staff, and that we are here for the students, to serve the community, to help them reach their academic and career goals. And I think that everyone is embracing Dr. Allen's vision, and that is helping us really meet the needs of this 11 county service area. that Central Georgia Technical College serves.
So if they meet you halfway, we'll meet you halfway, right?
Okay, well, we'll go even further than halfway. We don't mind that at all. I tell you, it's a privilege to get to do what we do every day in the technical college system as well. Definitely here at Central Georgia Technical College, we can honestly see changes in individuals' life trajectory within 15 weeks for some programs because it allows them to move into the workforce. And so there's that sense of pride that individuals have. They become productive members of society. They contribute positively to our tax base. They help us meet those not only workforce needs, but those healthcare needs. And then that goes back to Georgia being the number one state to do business. And so we like being a part or a participant in that.
How competitive is the program?
Right. So one of the things that's fortunate, I mentioned the enrollment growth. We have more applicants for many of our health programs than we actually have seats for the programs. Part of that is hiring additional faculty, but a bigger component of that is just the clinical sites. And that's where our partners really work with us well to help us have the clinical site so that our students can get that training. We'd love to expand that nursing program more because of the applicants and the quality of the applicants that we accept, but also the quality of the applicants based on GPA that just unfortunately are not able to gain a seat through no fault of theirs. It's just where the bar is set from the level of competition when it comes to our health sciences programs.
Thanks, Alvin. Now let's talk to President and CEO of Helston Healthcare, Charles Briscoe. How would you describe your partnership with Central Georgia Technical College?
Sure thing. We've been arm in arm with Central Georgia Technical College here in our community, Middle Georgia, for several years. I guess going back to 2008 or 9 probably is when it got a little more formal with some donations to start the nursing programs at Central Georgia Technical College. We went into an annual donation of about $75,000 a year to get those programs started. Was very successful on the Central Georgia Technical College perspective. Started to kind of meet the community need as much as you can with nursing. I mean, I don't know that we'll ever get up to par on where we need to be with nursing, but it was a great success in that partnership. That has continued at $75,000 a year since. And then I think 3 years ago, actually, Central Georgia Technical College, somewhat related and somewhat unrelated, we're getting into some athletic programs, soccer and football, just to be specific. And they were building a football field and a track, athletic facilities that, from our perspective, we weren't really into the soccer and the football, but it just adds to the campus environment, promotes health, the allied health programs there at the college. And if we can make a more engaging campus, we felt like it was worthwhile to get into to promote more people coming to Central Georgia Technical College for health sciences careers. So we took our $75,000 a year and formalized it for 10 years, such that it was a $750,000 commitment. And we're in year 3 of that. So that's been fantastic. I'm not really going in chronological order here, but, we also helped get with a land donation, get the Sonny Watson Health Sciences building funded and built by the state of Georgia. That is a beautiful building that is just state of the art with some of the labs and simulation labs that are there for EMT, nursing, really just state of the art. So state of the art, it could actually be used as about a 20-bed hospital, I believe. I might be wrong on the bed numbers. And actually during COVID, we tested that. And ironically, we could have done it, but didn't have the nurses. That just shows, again, the importance of nursing. And then one other major thing we went and did with Central Georgia Technical College is also with a third-party developer. We entered into a land deal to build some loft apartments to support both Central Georgia Technical College and the Trinity School of Medicine, which I'm sure we'll talk about a little bit later, to give just beautiful college housing to those students. And again, directly probably doesn't drive nursing or health science students, but it gives it that fantastic college feel, campus feel, sense of pride, if you will, that might attract more students that might choose those health sciences careers. So we did that proudly and Those are up. Phase one has been built for about 3 years now. Understand they're at capacity and high demand looking forward. So just a couple of major highlights. Those are the big programs. Their students are in our hospital every day. We're on their campus every day. It's really more than a partnership.
What makes this partnership so successful?
What we have here with our high school board of education, Central Georgia Technical College, our university systems, the private colleges. I know I'm leaving people out. Our hospitals. You've got a team that they're not going to agree on everything, but where there's common good, common need, common interest, we seem to be able to get to yes in this community. And there are even larger, more significant opportunities on the horizon in our community with some funding opportunities we're working on. But again, it's not just Central Georgia Technical College out there waving their flag, or Houston out there waving our flag, or the Board of Education, or Mercer, or Middle Georgia State, or whoever. It's people getting around the table and saying, can we do better in this area or that area, be it nursing or phlebotomy or EMT, paramedic, you name it. And can we go beyond high school seniors? Can we look at 8th grade, 9th grade, 10th grade, and give a career path? Those kinds of things. We've got people willing to get around the table and say yes. And it even goes beyond that to state level representatives, state level senators, able to sit around the table with us and just contemplate, what could be done, what would it take, and how do we get there? And again, trying to find yes. Dr. Alvin Allen, if I've heard him say it once, I've heard him say it 1,000,000 times. How do we get to yes? And that's what we do here. It's very impressive, but you just got to see what resources you have in the community and get them around the table. And if you can get them to commit to yes, you can get there. It may take a while, but you can get there. And I think the technical college system of Georgia at a state level, I know locally in our community, and from what I've heard in other areas like Augusta, Albany, and other areas across the state, their community's doing equally impressive work to what we're doing. And again, it's just looking at your community assets and resources and committing to get something done, and it's happening in that technical environment across the state right now. Just happy to be a part of it.
Thanks, Charles. Now let's talk to the president of Southern Regional Technical College, Jim Glass. Jim, can you talk to me about how the technical college system is bridging the gap for the current nursing shortage?
We're actively all the time pursuing strategic initiatives to expand our nursing and healthcare programs. First of all, and this is one of the things that we take very seriously. We make it a priority. Not only is nursing a high demand program for us and for the state of Georgia, but we know what those high demand programs are. And so we focus on those. And so to do what we need to do to prepare, to look ahead, we know what the nursing shortage is going to look like 10 years from now, 15 years from now. And our commitment is to bridge that gap. And so we strive to do that every day. As I mentioned a few minutes ago, the 1,500 students that we have in our nursing and nursing-related programs, we're going to continue to grow. We're going to continue to hire faculty. Sometimes when you talk about things that barriers, money is usually a barrier in hiring faculty. We have to pay those folks. An MSN, Masters of Science in Nursing faculty, of course, overall for a department, they by far are our highest paid group. And so funding is always an issue. But I will tell you this too. We are right now in technical education, in the technical college system of Georgia. As I told you a few minutes ago, this is my 26th year. I've seen a lot of highs and a lot of lows in technical education in Georgia. But right now in 2025 is the best time that I've ever seen. And here's where I'm going with that. I'm kind of going around to make my point. But Governor Kemp, the General Assembly, our Commissioner, Greg Dozier, understands what it takes to produce a well-educated workforce, and they are supporting us tremendously. So I say that to say for you to understand that although it takes money to hire the qualified faculty for nursing, Southern Regional is going to continue to do that. If we have the student need, and obviously we have become, and very fortunately become, the first choice in this part of Georgia, and we're excited about that, but also we're going to continue to be the first choice. And if it takes pooling our resources to be able to hire even more faculty to meet that 10-to-1 ratio and on, Southern Regional is going to continue to do that.
Thanks for listening to Talent Pipeline Georgia, a podcast brought to you by the Technical College System of Georgia. Visit us at tcsg.edu for more details. The Technical College System of Georgia. Meaningful careers start here.